My project is on the Mediterranean diet and its effects on obesity. So, first, we're going to talk about what obesity is, how to assess it, what influences it, and then the negative effects it has. Then, we're going to talk about the Mediterranean diet, its effects on obesity, and then go over a sample diet. So, what is obesity? The World Health Organization defines obesity as a condition of abnormal or excess fat accumulation in the adipose tissue to extent the health that may be impaired. So it's abnormal or excessive fat accumulation, but it doesn't specify the quantity of it. Some fat is beneficial, but some is not beneficial, and it's detrimental to health. There are differences between fat. For example, there's differences between brown and white fat, epitopic and non-epitopic, and visceral and subcutaneous adipose tissue. Obesity is also influenced by age, gender, ethnicity, and individual genetic or environmental factors, which make it a complex condition. So, how do we assess obesity? We assess obesity mostly with BMI. It's widely used to assess adiposity, but there's no correlation between BMI and fat mass. However, there also are several limitations to BMI when assessing obesity. The major limitation is that it can't distinguish fat from fat-free mass. BMI does not allow any conclusions as implications for health for an individual. So, for example, if you see a patient and their BMI is 35, the information you can give them is that they're obese. You can't tell them what that has an effect on their health. And then health providers need to assess how much visceral adiposity is present, because visceral fat is stored around the organs in the abdominal cavity and is linked to many health complications. And the BMI for obesity is over 30 kilograms per mass. And then pre-obesity is 25 to 30. So what influences obesity? There is a common misconception, and that's that many people think obesity is due to a person's willed control. And that's part of it, but there are other factors. So gender, heredity, environmental factors, and socioeconomic status also play a role. So for gender, males are more pear-shaped, while females are more apple-shaped. So females are predisposed to stronger subcutaneous fat deposition, resulting in a gynoid or gluteofemoral pattern of adipose tissue around or distribution, and that's the pear-shaped. And then males have more visceral fat, which is the apple shape. Puberty, pregnancy, and menopause also affect the fat distribution in accumulation. For women, pregnancy increases your adiposity, and then men have a higher rate of metabolic syndrome and cardiovascular disease. Then after menopause, these risks also increase for females. Genetic factors related to gender influence BMI and fat distribution. And then for heredity, you can have inherited leptin deficiency, and leptin deficiency is a recessive trait that can be inherited, and it can be treated with leptin replacement therapy, and that's basically the feeling that tells you you're full and that you aren't hungry anymore. And so if that is inherited, that you have a deficiency in that, it can make you less likely to know when you're hungry or not, or when you're full. Environmental factors. So people are less active if they have a poor diet, and then ready to eat foods are more available. So sedentary lifestyle and over consumption of foods are the two biggest roles. And then changes in the global food system, which produces more processed, more cheap, and more effectively marketed foods. And then social economic status, so that's healthcare, and then cost of food, and then limited access to healthy food. So your social class is a predictor of your body weight in many developing and industrial countries. Healthcare is really expensive, especially in the United States, and that's very hard for people to afford. Um, Food is marketed as healthy is generally a lot more expensive than the unhealthy food, specifically like organic and non-GMO foods. And then less affluent areas have limited access to a variety of grocery stores or healthier restaurants, and these can be considered food deserts. Okay, so what lifestyle factors influence obesity? So, diet, lack of physical activity, and smoking are all things that can be more in your control, I guess you could say. For diet, an increase in saturated fats, processed foods, and fried foods in the diet, those impact obesity and make you gain weight. Lack of physical activity, so a sedentary lifestyle, living in non-walkable areas. A lot of cities or rural locations aren't walkable, so people aren't able to move. And then increased screen time. This can be recreationally or for jobs. A lot of people